All right, let's reset and talk about something that might be bothering some people who are currently trying to manage their diabetes. Because the topic may deserve more clarity for you so that you can improve your health, right? Today we're going to talk about diabetic foot. And I don't care how long someone's had diabetes, this is one of those pay attention now so you don't panic later conversations. Even though I was diagnosed with diabetes about a little less than 5 years ago, I was able to lower my A1C from 13.0 to 5.5 within 6 months. And so, my responsibility here on this channel is not to provide medical advice, but it is to share my journey and what I have learned and accomplished. I hope you will stick with me and give me that chance to do so. Now, let's get into it. The wild part is that most people with diabetic feet don't wake up one day with a huge problem. It sneaks up on you, quiet, slow, almost polite. And that's exactly why it's dangerous. What usually starts this whole chain of reaction is high blood sugar hanging around longer than it should. Over time, it damages nerves and blood vessels. That's when people notice numbness, tingling, burning, or weird pins and needles feeling. You know that kind of feeling? Or sometimes nothing at all. That lack of feeling is what sets the stage for diabetic foot problems. Because when you can't feel pain properly, you also don't notice small cuts, pressure points, or hot spots in your shoes. Now, mix that nerve damage with poor circulation, and boom, you've got the perfect storm. Less blood flow means slower healing. That's how a tiny crack in the skin turns into a diabetic sore, then a diabetic ulcer, and sometimes a diabetic wound that won't heal no matter how much you ignore it and hope for the best. If you already have a diabetic ulcer, don't panic, but do act quickly. Diabetic wound care at home starts with keeping the area sterile. From a natural perspective, we look at things like medical grade manuka honey or calendula salves to support diabetic ulcer healing. But, and this is a big but, you must still consult with your doctor. A diabetic foot ulcer is not something to DIY if it's spreading or getting red. Natural remedies are your support system, not a replacement for a medical emergency. Here's the bigger picture. Real diabetes treatment isn't just about putting a bandage on a toe, it's about what you're putting in your body. We have to address the inflammation that causes diabetes complications in the first place. And let me be real with you. Hoping is not a strategy. This is why doctors push diabetic foot exams so hard. A real diabetic foot examination isn't just someone glancing at their toes and calling it a day. They're checking circulation, nerve response, skin integrity, temperature changes, and early warning signs that you might not even feel yet. Catching issues early can mean the difference between managing things calmly or dealing with diabetic foot infection later, which escalates very fast. Now, let's talk about complications because this is where people's eyes usually widen. When ulcers get infected, you're no longer in watch and wait mode. A foot infection in someone with diabetes can move quickly, especially when blood flow is limited. Redness spreading, swelling, warmth, drainage, or a strong odor are very normal. Ever. And if fever enters the chat, that's your cue to stop Googling and call a doctor immediately. There's also something called Charcot joint diabetic neuropathy, and this one scares people because it can happen without pain. The bones in the foot weaken and shift. The structure changes, and by the time it's obvious, serious damage has already occurred. This is why numbness is not a blessing, it's a warning. Now, here's where I switch gears because this is Nature's Healing Corner channel. And we don't just talk problems, we talk solutions. Diabetic foot care at home is powerful when it's done consistently and correctly. This isn't about being obsessive. It's about being aware. Checking your feet daily isn't dramatic, it's smart. Keeping skin clean, dry, and moisturized in the right places helps protect that first line of defense. Footwear matters more than people want to admit. Diabetic shoes and diabetic socks aren't trendy, but they reduce pressure, friction, and moisture, which are the top 3 reasons wounds start in the first place. Natural healing is about diabetes management every single day. You need to become your own best advocate. So let me walk you through the exact steps to follow. The 2-minute diabetic foot exam. Every single night, you need a diabetic foot examination. Use a mirror. Look for redness or a hot spot that could turn into a diabetic ulcer. Moisture is a double-edged sword. You want to hydrate diabetes legs to prevent cracking, but never put lotion between the toes. That's where a foot infection loves to hide. The right foundation, you need that. Ditch the tight elastic. Wear diabetic socks that breathe and diabetes shoes that don't pinch. And let's not skip over pain. Diabetes foot pain, leg cramp, swelling, or the discoloration in the diabetes legs category are signals, not annoyances, signals. Your body is talking to you. Ignoring it doesn't make you tough. It makes the cleanup harder later on. Now, let's talk about natural healing, but the responsible type. Supporting healing naturally is about creating the right internal environment so that your body can actually do its job. Blood sugar balance, reducing chronic inflammation, supporting circulation, nourishing skin and tissue, and calming the nervous system all play a role in diabetic ulcer healing and preventing repeat issues. Food choices matter as well. Nutrients matter. Movement matters. Stress management matters more than you even think or realize. But I need to say this loud and clear because I respect you too much to sugarcoat it. Natural approaches do not replace medical treatment when infections, ulcers, or structural damage are present. They work alongside proper diabetic wound care, not instead of it. This is not an either-or situation. It's a team effort with your doctor and yourself and that natural remedy. This is where long-term diabetes management actually succeeds or fails. Too many people focus only on blood sugar numbers, and they forget about complications until they're already knee-deep in them. Diabetes complications do not announce themselves with fireworks. They whisper first. So you have to be listening closely to hear and then act. If you're over 40, this matters even more. Healing slows naturally with age. Circulation changes with age, and inflammation rises with age. That's exactly why I created the Natural Healing Blueprint for Over 40. It's a 160-page ebook with 36 chapters designed to help you understand why these issues show up later in life and how to support your body intelligently using natural strategies without pretending doctors don't matter. There's a full chapter specifically on diabetes because this condition doesn't exist in isolation. It affects everything, especially your feet. So you need to know that. Here's the bottom line. Diabetic foot problems are serious, but they are not automatic and they are not hopeless. They can be healed and cured. Awareness changes the outcome. Early action changes the outcome. Consistent care changes the outcome. Your feet carry you through your entire life. They deserve more than a quick glance once in a while, don't you think? So pay attention now. Support your body daily and loop your healthcare provider into the process before small issues turn into big ones. That's how you stay ahead of all of this. Not scared, not overwhelmed, but informed and proactive. You have to take action. And that, my friend, is real healing. I hope you got some value from this, enough for you to pay close attention to your health, because that's my goal. And if that is the case, grab my healing blueprint for over 40 using natural remedies. Check with your doctor, though, when you see anything out of the norm. Manage your blood sugar every single day so that you can improve your health. Diabetes doesn't have to be a daily worry or anxiety if you stay in tune with your body and learn as much as you can to control it. Please subscribe to the channel and hit that notification bell so that you don't miss out on the next video coming up, where I am going to share more natural healing tips for different health issues. Thanks for watching, and guess what? I'll see you in the next video. Take care of your health.